This is another practical skills video. Today we're going to go through just the basic postural assessment. Now today's video is basically just going to go through how to perform an assessment very quick and easy, not actually worrying about doing any scoring of posture because that can actually be quite subjective, but actually just taking a global look at someone's static posture and from that determining whether they might have some areas of muscle tightness, muscle weakness, and then from there you could perform more specific range of motion, flexibility and strength assessments on those areas. And also it's really important to note that you should ask your patient or your athlete whether these so-called abnormalities are actually causing them pain, discomfort or affecting their performance, because a lot of the time posture gets blamed for these things when in actual fact it might not be a problem and these abnormalities may not need to be corrected. So we're just going to go through a basic postural assessment and have a look at some of the more common abnormalities that you'll see in the general population. So I'm just going to get Chris to come in here now. I'm just going to run through from top to bottom and have a bit of a look at static posture. So first of all, I'm just going to get Chris standing side on. I'm going to start by having a look at the head and the neck. So basically what we're looking at from the side on position here is just the head position, okay? And just seeing how it lines up with the trunk. Common abnormality that you might see here is sort of a forward head position. So something like this, and Chris is obviously exaggerating that position at the moment, but a forward head position may be indicative of tightness through the cervical extensors and some weakness through the deep cervical flexor muscles. Come back to normal for me, mate. Then if we have a look at the thoracic spine from side on, the thing we're looking for here is if there's excessive thoracic kyphosis or sort of like a hunchback. So just need to go a little bit forward, that's fine. And so things you'll note here is if that is sort of excessive through the thoracic spine. And again, this might be due to weakness of the thoracic extensor muscles to hold the trunk upright. And then if we have a look at the shoulders in a similar position here, if we see this kind of posture with the shoulders coming forward, this may be due to some tightness in the pec muscles, so pec minor and pec major. And if our shoulders or a glenohumeral joint is internally rotated, this might be due again to pectoralis major tightness, or even tightness through the internal rotator muscles, but probably more importantly, weakness through the external rotator cuff muscles to actually open up through the chest. Okay, so there's some of the things you'll look for in the upper back, shoulders and neck region. As we move down, if we have a look at the lower back, now again, we're doing this postural assessment wearing clothes because it's a lot more comfortable, especially the first time you're working with an athlete or a client, just to get them, make them feel comfortable, just ask them to stand nice and still, nice and relaxed, as they normally would, rather than making them feel uncomfortable or having to take clothes off and things like that. So you can get a good idea of the lower back and even just touch in on the lower back, have a look at how much lumbar lordosis they have. If there's an excessive lumbar lordosis or an anterior pelvic tilt, that might be due to tightness through the hip flexor muscles at the front or possibly weakness through the glute muscles posteriorly or the hip extensor muscles. Coming down now, if we have a look at the knees, not a hell of a lot to look for here. One thing to make note of though is we have hyperextended knees. So if we get Chris just to go into kind of like a hyperextension, you can see he has no real issues here. If Chris was going back into hyperextension, it may indicate that we have some weakness in the hamstring muscles or potentially weakness in the gastroc muscles as well, but it's not a hell of a lot to have a look at there. Finally, if we've sort of had a look in the sagittal plane, it's important to also look at things in the frontal plane or the coronal plane as well. Mainly also from behind, so frontal plane posteriorly. So I'm just going to get Chris to spin around for us. From a posterior view, if we again start up at the top, things to have a look at with the head and the neck would be any kind of lateral tilt of the head and neck, things like that, which may indicate tightness of muscles on one side or an imbalance of strength left to right, things like that. One thing you'll commonly find, particularly in athletes who play a throwing sport, their dominant shoulder will often sit higher than their non-dominant shoulder, and that's nothing to be concerned about. So even you can see here with Chris, his right shoulder sits slightly higher than his left shoulder, and that's due to just a bit more muscle mass around that right shoulder. It's nothing to be concerned about. You can also have a look at position of the scapula. Again, if the person's wearing clothes, if they've got just a loose fitting t-shirt on like Chris is wearing, you can just sort of press in a little bit. You can still see scapular position here. The things to note with scapular position, firstly, is whether the scapula is tilted forward or tilted back. If we're tilted forward, it may be indicative of tightness through pectoralis minor, because that muscle attaches to the coracoid process and may be pulling us forward. but also maybe some weakness through our trapezius muscles here, or our lower trapezius muscles to actually hold the scaps in that position. Again, scapular position is very subjective, and whether this is actually causing issues is more of an assessment we need to perform when looking at shoulder range of motion and whether they have pain with those sort of things. You don't want to jump to conclusions with this sort of stuff and say, okay, the scapula is sitting in a funny position, therefore we need to correct it. It's something that we might need to look at Chris and say, okay, well, he may have some weakness here, but is that actually affecting his function? Last couple of things, as we move down and look through the lower back and the pelvic area, things you can look for here is sort of the height of the pelvis, left to right, whether there's asymmetry there. You can ask your participant just to lift up their shirt a little bit at the back, and you can palpate and have a look at the PSIS, so the posterior superior iliac spine, and that can give you an indication of whether the pelvis is rotated or elevated more on one side than the other, which may indicate weakness through some of the hip muscles or even the lateral trunk muscles. But Chris here is actually fairly even, so there's nothing really to be concerned about there. Pop that down. And the last thing in the frontal plane, if we get Chris to spin around and we have a look from an anterior perspective, a couple of things. You can have another look at the shoulders, and you can probably see a bit more here whether we're internally rotated through the glenohumeral joint, tight through those internal rotator muscles. And then as we come down to the knee joint, things that you'll look for here is whether there's excessive knee valgus or knee varus. So if the knees are pushing in like this, or whether they're coming out to the side. You can see Chris's knees look fairly sort of normal there. One particular thing to note here is also internal rotation of the femur. If someone is in that kind of position, just want to be wary of that. Perhaps have a look at them walk and run, and whether that gets exaggerated anymore when they're doing those tasks, because that may lead to some knee pain and things like that. But again, looking at static posture, you're not going to make any judgments as to whether it's actually affecting their function. Last but not least, last thing to have a look at from the frontal plane point of view is foot posture. Won't go into too much depth with this. Chris, I'll just get you to flick both of your shoes off for me. And so you get someone, don't even have to be barefoot, they can just be standing in their socks. Hopefully they're wearing nice jazzy socks like Chris has got on here. What you can have a look at though is just whether their feet are pronated or supinated, or whether they're flat foot or whether they have high arches. So a flat foot would be when there's a bit of collapsing in through this area here and you can't sort of get your fingers in underneath. And a high arch would be when there's a really big gap in there. Most typically, you'll see people who have slightly flat feet. If someone has flat feet, it may be indicative of some weakness through muscles like tibialis posterior and our inverter muscles of our ankle. And again, that we can maybe work on that with some strength training. But again, it's important not to jump to conclusions with this stuff. It's just giving you a general indication of what may be going on, and then you can perform more specific range of motion and strength assessments from there. Alright guys, hopefully that gives you a nice little introduction to postural assessment. In the labs this week we'll go through a little bit more about how you can potentially score a postural assessment. Just wanted to give you a little brief overview to start off. Thanks guys.